Hello, and thank you for joining us for this week's Rise and Thrive with EHE Health, an interactive series where we discuss all things health together. My name is Natasha, and I'm the event coordinator with EHE Health. And today we're joined by Dr. Haider for American Health Month.
Thanks for having me.
Absolutely. Can you tell everyone a little bit about yourself and some things you like to do?
Sure. My name is Dr. Ali Haider. I am an interventional cardiologist. I'm practicing in Massachusetts. I'm an assistant professor of medicine, and I do both sort of clinical cardiology care, and I do procedures for patients who need heart stents and valves. So both from the preventative aspect of things to the treatment aspect of things. And I've been practicing in Massachusetts for the last 9 to 10 years. And things that I enjoy to do include playing with my 11-month-old child, which basically takes up all my time these days, which is totally fine.
Yes, that sounds like a fun, something fun to do, definitely. I wish I had more children in my family. But let's jump into the conversation. February is Heart Health Month, and this is a time of year that people can take the time to focus on their cardiovascular health. Here at EHE, preventative care is at the heart of everything we do. What are some preventative measures we should all be taking to maintain a healthy heart in our everyday life?
Absolutely. And, these are definitely important things to think about because, prevention is always challenging to convince folks because if they feel okay, they're going to generally do what they want to do. But the idea of prevention is to, changing some sort of behaviors that are going to prevent things from happening in the future. So, it's really nothing sexy. It's stuff that people have heard before. For example, what you eat, right? Your diet, what you eat and your dietary intake, how much you eat is super important in mitigating your risk over the course of time. Similarly, things that you don't take, such as smoking cigarettes, okay? Don't smoke cigarettes, limiting the amount of alcohol you're intaking, and other sort of healthy habits, even things such as sleep, okay? Getting enough sleep is super important. With that comes, of course, exercise and getting an adequate amount of exercise, or even just doing more than you do now, particularly for people who are sedentary and have sedentary jobs. Can you make a change in how much you're actually doing on a daily basis, right? And these, all these features are going to be helpful in the long run. Think of exercise and diet like medications you're going to take for the course of time to prevent things. And finally, know what your numbers are. Now, when I say numbers, these are things that your physician, your primary care doctor, your general practitioner is going to help you with, such as, basic things. Obviously, what is your weight? What is your waist circumference? What is your body mass index? These are basic metrics we look at to see how healthy are you on the spectrum of being overweight or obese, etc. Other things that require blood tests, such as your blood sugar, right? A lot of people, for example, who have diabetes or pre-diabetes don't know about it. This is something that can be simply checked with a blood test, but you have to see your primary care doctor for that. Similarly, cholesterol numbers, right? Knowing what your cholesterol number is, and blood pressure. Right? These are simple things that can be obtained in a simple yearly primary care visit. And then for folks who may have family history and other genetic predispositions to having heart attacks and strokes, there may be even more things that may be worthwhile. But again, this involves you seeing your physician. So basically taking control of what you're doing in your lifestyle, but also making sure you're seeing your primary care physician to kind of knock off those check boxes to make sure you're not one of the unlucky ones who may have something earlier in life that you don't know about.
Yeah, definitely. And you mentioned diet and exercise. What are some, foods that are good and healthy for the heart? And what are some exercises that people can do as well?
Yeah, sure. And the nutrition camp, and especially the internet, is vicious, right? Everyone's going to have their own sort of views on this, and it's challenging to do high quality studies with with diet and nutrition. But there are several things that we do know that were recurrent themes in the scientific literature. Number one, intake of saturated fats that are going to increase your cholesterol are generally not good for you, right? So, too much red meat, fatty meat, animal fat in general, right? Too much intake of animal fat. We think of course, red meat and fatty cuts of red meat to be the biggest culprits there. But even other animal fats in too much intake, particularly, is not good for you. The really hardcore components, the vegans and vegetarians will tell you absolutely no animal products, and that's one version look at it. But in the real world, not everyone's going to be able to follow an absolute elimination of animal products. So I tell folks, look, make sure you're limiting the amount of animal fat you're intaking, because that's packed with saturated fats and it'll increase your bad cholesterol. Similarly, certain types of fats, solid fats, right? Think of things that are solid: butter, right? Tropical oils, palm oil, coconut oil. People don't realize those are quite unhealthy for you.
Okay.
You want to stick with the healthier sources of fats, such as, oils. If you're going to cook with oil, you're going to use olive oil, you're going to use canola oil, and other things that have healthier oils like nuts, right? Different types of nuts are more healthier sources of fat. And of course, bottom line is try to eat more plants, increase the intake of vegetables, high fiber products such as legumes and things like that are overall very healthy. And the summary is the Mediterranean diet. That sort of is the basis of what we recommend in the cardiology world. As far as exercise goes, again, if you go by the recommendations, the American Heart Association recommends 150 minutes of moderate exercise per week, right? So that's about 30 minutes a day for 5 days a week of moderate exercise. And that could be a light jog, that could be a brisk walk, something that gets your heart rate up and gets you huffing and puffing a little bit, right? Or if you're going to do 75 minutes of vigorous exercise, if you're into HIIT training, you're interval training, you're into high level Peloton stuff, you're going to do more vigorous exercise, they recommend at least 75 minutes. Now, that being said, some people hear that, oh, I'm never going to be able to do that, forget it, right? They're going to just continue in their ways. No, because we know that even small increments of exercise and activity can make a difference. In fact, there was a recent study that looked at sort of middle-aged folks between the ages of 40 up to 60, and they say, hey, let's track how many steps these guys and girls are taking in a day. And what they found was if you took over 7,000 steps a day, there was something like a 70% less chance of you dying in the subsequent 10 to 20 years. All right. So folks who are less than 7,000, higher risk. But if you could do over 7,000, you don't even have to hit that 10,000 number. But if you do, fantastic. Over 7,000 steps a day, you will live longer, right? So any change from what you're doing is important.
Yeah, that's great advice. Just knowing that, like, I know I work in an office, so getting up and moving around, I always try to make a point of it to refill my water throughout the day and not just sit there all day. So that's great advice and something that anybody can easily incorporate into their day as well.
Absolutely.
And what are a few main causes of heart issues and some signs that may be a point of a heart issue as well?
Sure. So first of all, we know there's a lot of established risk factors for developing heart disease. We talked about some of those before: lifestyle, like diet, exercise, smoking cigarettes. Things such as high cholesterol is a major one. People with elevated cholesterol, be it by diet or genetics, that's a major, major predictor of heart disease and stroke. High blood pressure, also known as the silent killer, because folks often have very high blood pressure uncontrolled and they don't know about it. And again, if you don't see your doctor, you may not know about it. Genetics, family history is an important one. Folks who have strong family histories of people having heart attacks in the family, that genetic predisposition can also be very, very important. In terms of signs of heart attacks, the classic, we educate folks, the classic symptoms of someone having a heart attack is obviously chest pain or chest pressure. One important point is, not everyone has pain. People who get tightness or pressure in the chest is a common scenario. Oftentimes, you may feel it going to the arm, associated with sweating or shortness of breath. Now, that being said, there can be atypical presentations, especially in females. Sometimes they don't have the classic constellation of symptoms. You may have a burning in the chest. It may sometimes be mistaken for acid reflux. That can happen very commonly. Or sometimes just, an uncomfortable sensation of shortness of breath. So, the bottom line is, if you feel like something's wrong, even though you're not having, quote, chest pain, better be safe than sorry, especially if you have these risk factors. And, speak to your doctor or pick up the phone and just, discuss your symptoms with someone if you're not going to go see someone about it.
Great. Yeah, that's great advice. Because, sometimes people, they think it might be nothing and some people like to tough it out or they don't want to go to the doctor. So just like as you mentioned earlier, it's so important to like know your numbers and definitely understand your body so you know if something's a little bit off.
That's exactly right. And as they say, if you're having a heart attack and you foo-foo it, the longer you wait, the more damage can be done. So, time is muscle, as we say in cardiology. So, remember that.
That's great. And is there anything else you'd like to add today for those that are watching?
No, I mean, look, your heart is your most important organ. It beats 100,000 times a day. It may beat up to 2 to 3 billion times in your lifetime. So it works hard. It needs to be taken care of. If you want to live a long, healthy life, some of the decisions you make now are going to impact things 10, 20, 30, 40, 50 years down the line. So stay healthy.
Yeah, absolutely. Although we focus on Heart Health Month in February, it is something that we should be mindful of all year round. Like Dr. Haider said, you need to know your numbers, be mindful of your nutrition, and get some extra steps in. Thank you, Dr. Haider, for joining us today and sharing your advice and knowledge on heart health.
Very welcome. Thank you.
Thank you. Follow us on Facebook, LinkedIn, and Instagram for additional content. Thank you all for participating and happy Heart Health Month.